Imagine this for a moment. If we trace back through human history, we find evidence right back in the New Stone Age, that's thousands upon thousands of years ago, showing that people were, well, already figuring out how to treat broken bones.
It's quite extraordinary, isn't it?
It really is. Simple splints, even, attempts at amputation, they're visible in the archaeological record. That's orthopedic medicine right at its absolute dawn.
The very beginning.
Then fast forward, bypassing centuries, to the late 1890s, and suddenly, almost overnight, the invention of the X-ray completely transforms how doctors understand bone injuries.
A pivotal moment, absolutely.
It just shows how profoundly deep the roots of this medical field go, and at the same time, how quickly, how radically it can be reshaped by innovation. Welcome to the Deep Dive. I'm your host, and in this episode, we are embarking on a pretty comprehensive deep dive into the fascinating, complex, and frankly, rapidly evolving world of orthopedic surgery.
It certainly is evolving quickly.
We're unpacking a significant report titled The Evolution of Orthopedic Surgery, Past, Present, Future. Now, musculoskeletal conditions are incredibly pervasive, aren't they? They impact the lives and mobility of millions globally.
Absolutely. From, simple fractures and joint issues right through to complex spinal deformities or debilitating sports injuries.
Yeah.
The scope is vast.
It really is. And orthopedic surgery stands as that dedicated branch of medicine focused on, well, everything. The diagnosis, treatment, rehabilitation, and prevention of disorders affecting the bones, joints, ligaments, tendons, muscles, nerves, the whole system.
The body's framework.
Exactly. It's a field that is just constantly pushing the boundaries of what's possible to restore form and function. To navigate this extensive journey through time and also to peer into the future, we're fortunate to be joined today by an expert with a deep understanding of this field's history, its current state, and crucially, the trajectory of its future innovations.
Thank you. It's a real privilege to be able to explore this material with you and your listeners today.
Brilliant.
The report you highlighted really does capture the remarkable sweep of orthopedics. It illustrates how human ingenuity, often forged in, quite difficult circumstances, has continuously expanded our ability to repair and enhance the body's structural framework.
It really does trace a compelling narrative arc, doesn't it? Starting from what we might think of as almost intuitive, perhaps primitive beginnings.
Though surprisingly effective sometimes.
Yes, exactly. Scaling through periods of, stagnation and then revival, all the way to the incredibly sophisticated high-tech medical landscape we see today, and then looking towards those potentially revolutionary treatments on the horizon.
It's a story rich with contributions from key figures, absolutely, and marked by some truly seismic technological shifts along the way.
So let's jump straight into it then with a sort of rapid-fire setup just to give you a taste of the incredible journey this report outlines. Professor, based on that ancient evidence we touched upon right at the start, what's one key takeaway about the level of understanding or perhaps the ingenuity applied to bone injuries even with such limited tools back then?
Well, what is profoundly striking, I think, from the archaeological record, and the report highlights this in its early sections, is the inherent practical wisdom that was demonstrated.
Practical wisdom, I like that.
Yes. Even without, a detailed understanding of biological processes or sterile technique as we know it, early humans clearly recognized the fundamental need for stabilization, applying splints, understanding that a limb needed to be held still to heal.
Just basic mechanics almost.
Basic mechanics, yes. Or even making that stark decision for amputation when a limb was clearly unsalvageable. These indicate a surprising level of observation and pragmatic intervention. And it wasn't just aimed at immediate survival, but also, crucially, at attempting to restore some degree of function, for hunting, gathering, daily life.
Right, to get back to doing things.
Exactly. It speaks volumes, I think, about that persistent human drive to overcome physical limitation.
Right. That focus on restoring function, even thousands of years ago. Remarkable. Okay, second question. How did major 20th century conflicts, thinking specifically of the World Wars, act as unexpected, albeit rather grim, accelerators for orthopedic innovation?
Well, the demands of total war, they forced innovation at an unprecedented pace. The sheer volume and severity of battlefield trauma, we're talking complex fractures, devastating open wounds, extensive soft tissue injuries.
Things you wouldn't normally see on that scale.
Precisely. It necessitated rapid development of new techniques. Surgeons were confronted daily with injuries they'd rarely, if ever, see in peacetime. This environment, this pressure cooker, spurred crucial advancements.
Such as?
For example, in managing contaminated wounds, developing more robust and reliable methods for internal fixation of complex fractures, so using metal plates and screws, and also refining amputation and prosthetic fitting techniques.
Right. Driven by immediate need.
Absolutely.
Yeah.
It wasn't theoretical research sitting in a lab. It was urgent life and death problem solving that directly translated into more sophisticated and effective surgical practices, practices that were later adopted globally in civilian care.
A truly brutal catalyst for progress, as you say, but progress nonetheless. And finally, looking at the cutting edge right now, what's the single biggest technological trend that's reshaping surgical practice, according to this report?
If I had to encapsulate the dominant trend of the present and the near future, it is undeniably the deep integration of digital technologies,
Digital.
meaning robotics, advanced navigation systems, artificial intelligence, 3D printing. These aren't just supplementary tools anymore. They are fundamentally altering how surgeons plan, execute, and assess procedures
How so?
by significantly enhancing precision, accuracy, and the ability to personalize interventions to an individual patient's anatomy. This digital revolution is, well, perhaps the most transformative force we've seen since the X-ray itself.
Precision, accuracy, personalization. Those are powerful keywords in any field, I suppose. That gives us a fantastic roadmap for this deep dive. Let's truly unpack this now, starting right at the beginning of orthopedics' long, long history. Okay, so our first deep dive segment takes us from those incredibly ancient roots we just touched upon, all the way through to the revolutionary shifts of the 20th century. The report begins by grounding us in the sheer antiquity of musculoskeletal injury treatment. Archaeological evidence from the New Stone Age is, as you said, astonishing, showing evidence of treated fractures, even complex procedures like amputations. What can this really tell us about the early human understanding of the body and injury?
It is, as you say, quite astonishing. And the source material points to findings across various continents, so it demonstrates that this wasn't just an isolated phenomenon.
Right, it was widespread.
Indeed. Discoveries like skeletal remains showing healed fractures with clear evidence of splinting or, cleanly severed bones consistent with amputation, followed by signs of survival. They underscore that early humans were not just passive victims of injury, they actively intervened.
They tried to do something.
Exactly. And while their understanding was empirical, based on observation rather than scientific principles as we know them, they clearly grasped cause and effect. Instability hindered healing. Loss of a severely damaged limb could save a life.
Makes sense.
This early focus on mechanical principles, albeit simple ones, really foreshadows the biomechanical nature of modern orthopedics. It highlights an almost innate understanding of how to support and manipulate the body's framework to facilitate recovery.
So a practical, almost trial and error approach that actually yielded real results. Moving forward a bit, the report highlights the contributions of key ancient civilizations. Could you tell us a bit about the foundational work happening in places like Egypt, Greece, and Rome?
Certainly. Ancient Egypt, for instance, had a surprisingly sophisticated medical system for its time, which is well documented in various papyrus. The Edwin Smith papyrus, in particular, dates back thousands of years and includes quite detailed case studies of injuries.
Like what sort of injuries?
Dislocations, fractures, offering early insights into diagnosis and treatment methods, some of which seem surprisingly rational even now. Imhotep, who's often revered for his architectural achievements, was also a physician credited with early surgical texts.
Ah, I didn't know that.
Yes. Then, crucially, we arrive at ancient Greece. Hippocrates of Kossus, often rightly called the father of modern medicine, didn't just lay down ethical principles. He also made significant contributions to treating injuries.
Specifically orthopedic ones.
Yes, the report specifically references his techniques for managing joint dislocations, particularly the shoulder. His methods, which involve specific maneuvers to reduce the dislocated joint using leverage and counterpressure, were remarkably effective.
And are they still used?
Well, some of the underlying principles are still taught and adapted in modern emergency medicine and orthopedic texts today. It really demonstrates the enduring power of astute clinical observation.
Incredible. And Rome.
The Roman Empire built upon that Greek knowledge. They excelled in organization, hygiene, and documentation, leading to more widespread and systematized medical practices, including orthopedics, especially, with the needs of soldiers in mind.
It is quite incredible that principles developed by Hippocrates millennia ago are still relevant. Yet the report does note a period of relative stagnation in medical and specifically orthopedic advancement during the European Middle Ages. What factors contributed to that slowdown?
Yes, the Middle Ages particularly in Europe, saw a significant decline in the sort of scientific inquiry that had characterized the classical world. The report points to the dominant influence of the Catholic Church during this era.
How did that affect things?
Well, whilst the Church played a vital role in establishing hospitals and providing care, its doctrines at times restricted practices crucial for medical progress. Specifically, the discouragement or sometimes outright prohibition of human dissection severely hampered the understanding of anatomy.
Ah, right. You can't fix what you can't see properly.
Precisely. Without the ability to meticulously study the internal structure of the human body, the bones, muscles, nerves, vessels, surgical knowledge inevitably stagnated. Practices became more empirical again, often intertwined with superstition or religious dogma, rather than building on a foundation of anatomical science.
That makes perfect sense. If you can't truly understand the machine, you can't effectively repair it. But then came the Renaissance, and the report speaks of a vital revival.
Exactly. The Renaissance marked a powerful resurgence of interest in classical learning, humanism, and crucially empirical observation. There was a renewed fascination with the human form.
Like Leonardo da Vinci.
Exemplified by artists like Leonardo da Vinci, yes. His anatomical drawings, while perhaps not always perfectly accurate by modern standards, represented an intense drive to understand the body's mechanics and structure. But more significantly for medicine, figures like Andreas Vesalius revolutionized anatomy through systematic public dissection.
Vesalius, right.
His seminal work, De Humani Corporis Fabrica, published in 1543, corrected centuries of anatomical errors and provided an unprecedentedly detailed map of the human body. This revival of rigorous anatomical study provided the essential scientific bedrock upon which modern surgery, including orthopedics, could finally be built.
So that laid the foundation.
Alongside this, of course, the establishment and growth of universities and hospitals fostered centers for learning and practice.
So the scientific foundation was restored, correcting errors and providing a detailed understanding. And the very term orthopedics itself was coined during this later period of renewed interest, wasn't it?
Yes, that's right. The term orthopedics was formally introduced by the French physician Nicolas-André de Beauregard in 1741. He published a book called Orthopaedia, or The Art of Correcting and Preventing Deformities in Children.
So originally just for children.
Exactly. The title itself, derived from Greek words meaning straight and child, clearly indicates its original, quite narrow focus on treating childhood deformities, mostly through physical methods, braces, exercises, symbolized by that famous illustration of a crooked tree being straightened by a stake.
I think I've seen that image.
It's quite iconic. But over time, driven by that growing anatomical knowledge and surgical capability, the field dramatically expanded its scope. It now encompasses the diagnosis, treatment, and prevention of disorders affecting the entire musculoskeletal system across all age groups, using both surgical and non-surgical means.
It's fascinating how the name stuck, but the focus broadened so dramatically. Now, let's leap ahead to what the report identifies as a truly pivotal moment, a real turning point, the 20th century. And arguably the most significant single invention mentioned is the X-ray. How did Wilhelm Conrad Röntgen's discovery in 1895 trigger such a revolution in orthopedics?
Well, the invention of the X-ray by Röntgen in 1895 was, frankly, nothing short of a paradigm shift for medicine and especially for orthopedics.
Why so dramatic?
Because before this, as I mentioned earlier, diagnosing the exact nature and extent of a bone injury required significant guesswork. Based on external examination, manipulating the limb, which was often painful.
What, even cutting someone open just to see?
Or in complex cases, yes, making an incision to visualize the bone directly, which carried significant risks of infection and increased trauma. Suddenly, for the very first time in human history, doctors could actually see through tissues to visualize the bones and joints non-invasively. A broken leg wasn't just suspected anymore. You could see the precise fracture pattern, the degree of displacement, whether multiple fragments were involved, the whole picture.
So it went from estimation, essentially, to actually seeing the problem clearly laid out.
Exactly. And this ability fundamentally transformed diagnosis and, crucially, treatment planning. Surgeons could now plan their approach with unparalleled precision based on the visible anatomy and pathology.
Making surgery safer, presumably.
Safer, more accurate. They could assess the results of reduction maneuvers without needing repeat invasive checks. This vastly improved accuracy reduced patient suffering, and significantly lowered the risks associated with treating bone injuries. It wasn't just an incremental improvement. It was an instantaneous leap forward that reshaped the entire practice of orthopedic trauma care and beyond. Its impact really cannot be overstated.
A clear picture truly changed everything. And then, as we touched upon in the rapid-fire round, the grim necessities of the World Wars added another layer of intense rapid development. How did the sheer scale and severity of wartime injuries push orthopedics forward again?
Well, the World Wars, particularly World War I and II, presented orthopedic surgeons with challenges on an unprecedented scale and complexity. They were dealing with mass casualties, presenting with horrific open fractures, severe soft tissue damage, often contaminated with battlefield debris, nerve injuries, the need for frequent amputation.
These overwhelming numbers and severity.
Utterly overwhelming. The sheer volume of trauma demanded faster, more effective, and more reliable treatment methods. This pressure cooker environment led to significant innovations.
Can you give an example?
Certainly. Techniques for managing deeply contaminated open wounds evolved, rapidly moving towards thorough cleaning, what we call debridement, and delayed closure to prevent infection, which was a huge killer back then.
Right, infection was a massive problem.
Massive. Also, methods for stabilizing long bone fractures advanced dramatically. We saw the development and refinement of various internal fixation techniques using plates, screws, and later intramedullary nails. Those are rods inserted down the center of the bone.
Developed right there in the field hospitals.
Often pioneered in wartime hospitals under intense pressure, yes. Techniques for effective amputation revision and the development of better prosthetic limbs also saw significant investment and innovation, driven by the needs of injured servicemen and women.
So a direct response to need.
Absolutely. These advancements, born of necessity on the battlefield, were quickly adopted and further refined for civilian trauma and reconstructive surgery after the wars concluded. The foundation for modern trauma orthopedics owes a great deal to the lessons learned in those conflicts.
So wartime expediency leading to enduring civilian techniques. Beyond the immediate impact of war, the latter half of the 20th century saw further revolutions in medical imaging. The report highlights the introduction of CT and MRI scans. What level of detail did these technologies add compared to conventional X-rays?
Right. So while the X-ray gave us that initial revolutionary two-dimensional view through the body, computed tomography, CT, and magnetic resonance imaging, MRI, introduced something quite different. Detailed cross-sectional or slice views, plus the ability to reconstruct images in 3 dimensions.
So like seeing slices through the body.
Exactly. CT scans are particularly adept at visualizing bony structures with exquisite detail. They can reveal complex fracture patterns, subtle alignment issues, or degenerative changes that might not always be clear on plain X-rays.
And MRI.
MRI, conversely, excels at imaging soft tissues, things like ligaments, tendons, cartilage, muscles, nerves, spinal discs. It provides clarity on injuries like, say, meniscal tears in the knee, ligament ruptures, or disc herniations that X-rays simply cannot show at all.
That sounds like a leap from having a basic blueprint to suddenly seeing all the intricate workings of the joint or the spine.
That's a very good analogy. Exactly. This level of detailed, multiplanar, and 3D visualization profoundly improved diagnostic accuracy for a much wider range of musculoskeletal conditions, well beyond simple fractures.
And that impacts surgery how?
Crucially, it enabled surgeons to plan complex procedures, things like joint replacements or intricate spinal surgeries, with far greater precision and foresight. They can map out their approach, understand the full extent of the pathology, anticipate challenges, all before making the first incision. This marked a significant acceleration toward a much more technology-assisted, data-driven approach to orthopedics.
It's clear then that these historical developments, from that ancient ingenuity and anatomical rediscovery through to the seismic shifts brought by X-rays, CT, and MRI, they really established the crucial foundation for modern orthopedics.
Absolutely. They built the essential knowledge base, they introduced non-invasive diagnostics, refined surgical techniques, all laying the groundwork for the sophisticated practices and the incredible technological advancements we see influencing the field today, and of course those just on the horizon.
Right, let's transition now and look firmly at where orthopedic surgery is in the present moment and explore the truly exciting, potentially disruptive directions it's heading in the future. Okay, this next segment takes us right to the cutting edge. We're exploring the current trends that are reshaping how orthopedic procedures are performed and gazing into those fascinating future horizons. The report details several key areas of intense innovation happening right now. First up, minimally invasive surgery, or MIS. What's the fundamental principle driving this approach, and why has it become so, well, central to modern orthopedics?
Well, Minimally invasive surgery, or MIS as the name suggests, is really centered on achieving the therapeutic goal, whatever that might be, with the least possible trauma to the patient's surrounding healthy tissues.
Less damage, basically.
Less collateral damage, precisely.
Yeah.
The core principle is to avoid those large open incisions, instead opting for smaller cuts, sometimes just keyholes, through which specialized instruments are inserted, often including a small camera, an endoscope, or an arthroscope.
So the surgeon operates by looking at a screen.
Exactly. Viewing the surgical field on a monitor, which gives a magnified view.
And where is this approach most widely applied today? Which sorts of procedures?
Oh, it's become the standard of care for a vast array of procedures now. Common examples include arthroscopic surgery for joints like knees, shoulders, hips, for repairing ligaments, cartilage, removing loose bodies. Also, less invasive techniques for spinal procedures like discectomies or fusions, and increasingly minimally invasive approaches to joint replacements, particularly hip and knee replacements.
Right. And the benefits for the patient. Why is this such a significant shift from traditional open surgery? What does the patient experience?
Well, the benefits are profound, really, and they directly impact the patient's recovery journey and their overall outcomes by making smaller incisions and, crucially, disturbing less muscle and soft tissue.
That's the key part.
That is a key part, yes. Patients experience significantly less postoperative pain. This often translates to a reduced need for strong pain medication, shorter hospital stays, sometimes even allowing outpatient surgery for certain procedures.
So you can go home the same day?
In some cases, yes. And perhaps most importantly, it usually means much faster rehabilitation and a quicker return to normal activities. Plus, there's reduced scarring, lower risk of infection and blood loss compared to large open procedures. It allows patients to regain function and mobility much more quickly.
Less pain, faster recovery. Those are very clear wins for the patient. Another major trend, and one that sounds, well, very futuristic, is the integration of robotics and advanced navigation systems. How are these technologies changing the act of surgery itself?
Yes, this is perhaps one of the most significant shifts happening inside the surgical suite right now. Robotics and navigation systems, they're designed to enhance surgical precision and accuracy to levels that are, frankly, simply unattainable with the human hand and eye alone.
How do the navigation systems work?
Navigation systems often use infrared cameras and special markers placed on the patient's bone and the surgeon's instruments. They create a real-time, computer-generated map of the surgical field, often overlaid with the preoperative imaging like a CT or MRI scan.
So it's like a GPS for the surgeon.
That's a very good way of putting it. An incredibly precise GPS system for the surgeon, showing exactly where their instruments are relative to the patient's unique anatomy of the bone, but also nearby ligaments, nerves, blood vessels.
So it's like having a detailed live 3D map guiding every single movement.
Precisely that. And robotic systems often work in conjunction with this navigation. The surgeon plans the procedure digitally on the computer based on the patient's specific anatomy and the problem being treated.
Right.
The robotic arm can then assist the surgeon in executing that plan with incredibly high fidelity. This might involve, say, preparing a bone surface for an implant with sub-millimeter accuracy, or drilling screw holes at exact angles and depths, or guiding a saw within predefined safety zones to protect critical structures nearby.
So it's not the robot doing the surgery on its own?
No, absolutely not. It's crucial to understand that. Our surgeon is always in control. It sounds like the technology is assisting the surgeon, allowing them to perform the plan with unparalleled control. That's exactly it. It's about augmenting the surgeon's skill with robotic precision and navigational guidance. It enhances their capability.
And where is this most impactful?
It's particularly impactful in procedures where exact alignment and implant positioning are absolutely critical for long-term success. Think about total joint replacements, hips and knees especially.
Why is alignment so important there?
Because optimal implant alignment, which we can achieve more consistently with robotic assistance, directly impacts the wear rate of the implant components over time. It also affects joint stability and ultimately contributes to better functional outcomes for the patient. And potentially, it increases the lifespan of the implant itself, reducing the need for future revision surgeries down the line. It just reduces variability and enhances the reproducibility of the desired outcome.
Precision translating into better, more durable results for the patient. Moving to another revolutionary technology, 3D printing. This has moved from just making prototypes to actual clinical application. How is this transforming what orthopedics can achieve?
Yes, 3D printing, or additive manufacturing as it's also known, is having a significant impact in several areas that the report highlights. One of the most compelling applications is the creation of highly customized implants.
Customized how?
Well, for complex cases, say, reconstructing parts of the pelvis or the face after severe trauma or perhaps tumor removal, standard off-the-shelf implants simply won't fit properly. Using 3D printing, based on a CT scan of the patient, surgeons can design and then manufacture an implant that precisely matches that patient's unique anatomy.
Truly custom-built implants for unique needs, then.
Exactly. This results in a much better fit, which leads to improved function, and it can also significantly reduce operative time because the implant is designed to slot in perfectly, more or less.
Makes sense. What else?
Beyond implants, 3D printing is used increasingly to create patient-specific surgical guides. These are essentially templates, often for cutting bone or drilling holes, that fit precisely onto the patient's bone during surgery. They guide the surgeon to make cuts or place screws exactly as planned preoperatively.
So it standardizes the precise execution based on the preoperative plan, takes out some guesswork.
Yes, exactly. It takes some of the potential variability out of the procedure. And perhaps one of the most exciting applications, certainly from a planning perspective, is printing anatomical models.
Physical models of the patient's bones.
Yes. Using a patient's imaging data, a surgeon can 3D print an exact replica of, say, a complex broken ankle or a deformed spine or a challenging joint requiring replacement. This physical model allows the surgeon to hold the replica in their hands, study the pathology in 3 dimensions, see the angles, and even simulate or practice the entire surgical procedure beforehand.
Wow. Being able to literally practice the surgery on a model of your specific bones before the actual operation, that must provide a huge advantage in planning and confidence, I imagine.
It absolutely does, particularly for complex or unusual cases. It allows the surgeon to anticipate and troubleshoot potential issues, refine their approach, and ensure they are fully prepared, which translates directly to increased efficiency and safety during the actual operation.
Makes perfect sense. Another area of burgeoning innovation mentioned is regenerative medicine. What does this field promise for orthopedics? It sounds quite different.
It is quite different conceptually, yes. Regenerative medicine in orthopedics focuses on leveraging the body's own biological healing mechanisms to repair or regenerate damaged musculoskeletal tissues. So, rather than solely relying on mechanical implants or removing damaged tissue, it aims to heal from within.
How does it do that?
It involves using biological materials, things like stem cells, growth factors, or sometimes specially engineered tissues to stimulate healing in bone, cartilage, tendons, or ligaments.
And what's the ultimate potential of this approach? Where could it lead?
Well, the long-term potential is really significant. In some instances, it could potentially reduce or even eliminate the need for artificial implants altogether by promoting true biological repair.
Really? Replace a joint replacement?
That's the long-term hope for certain conditions, yes. Techniques are being explored and applied now for things like cartilage defects, non-healing fractures, what we call non-unions, and chronic tendon injuries. The goal is to achieve more complete and durable healing, potentially leading to better long-term functional outcomes and reducing the incidence of degenerative changes or the need for future surgery down the line. It's really about harnessing and enhancing the body's innate capacity to heal itself.
Healing from within rather than just replacing parts. Fascinating. The report also highlights technologies that improve access and patient management, both before and after surgery, things like telemedicine and remote monitoring. How are they fitting in?
Yes, these technologies are proving critical for extending the reach of specialized orthopedic care and also for enhancing the postoperative journey for patients. Telemedicine, for instance, through virtual consultations via video or phone.
Like we're doing now, almost.
Exactly. It significantly improves access for patients in remote areas, or perhaps those with mobility issues who might struggle to attend frequent in-person appointments. It's proving effective for initial triage, for many follow-up assessments, and for managing post-operative progress remotely.
Bringing the specialist consultation directly to the patient wherever they are.
Essentially, yes. And remote patient monitoring, often using wearable devices like smartwatches or integrated smartphone apps, allows healthcare providers to track a patient's recovery in real time after they've left the hospital.
What sort of data gets tracked?
Things like activity levels, step counts, movement patterns, gait parameters, sometimes range of motion measurements, and also self-reported pain scores can be collected continuously or frequently.
How does having that continuous data stream actually help the clinical team?
It enables much more proactive management of the patient's recovery. If there are deviations from the expected progress or sudden changes in activity or concerning pain trends, these can be flagged up early. This allows the clinical team to intervene, perhaps before a minor issue becomes a major complication. It provides reassurance to both the patient and the care team as well.
Keeping a close, data-driven eye on recovery, even from a distance. And linked to that, I suppose, is the idea of personalized rehabilitation plans, often delivered via telerehabilitation.
Yes, telerehabilitation programs are a rapidly growing area. These leverage technology to provide patients with personalized exercise regimens and guidance from physiotherapists or other rehabilitation specialists, but remotely.
How does that work in practice?
Usually using video calls for check-ins and assessments, perhaps apps with instructional videos for the exercises, and sometimes even sensor feedback from wearables to monitor how the exercises are being performed. Patients can do their rehab from the comfort of their own homes while still receiving expert supervision and having their program adjusted as needed.
And what's the main benefit of this personalized remote approach? Does it work as well?
Well, one of the key benefits appears to be significantly improved patient adherence to their rehabilitation protocols. And adherence is absolutely critical for achieving optimal outcomes after surgery. The report actually highlights some compelling data, suggesting that patients engaged in personalized telerehabilitation programs may return to their daily activities up to 30% faster compared to those undertaking more conventional, perhaps less supervised rehabilitation.
30% faster return to activity, that's a really tangible impact on someone's life and work, isn't it?
It's a very substantial benefit for patients, yes, getting back to independence in daily life more quickly.
So we've covered the exciting present landscape. Looking ahead now, what are the key future directions, the next phase, if you like, for orthopedics that the report points towards?
Right. The future of orthopedics, as outlined in the report, really builds upon these current trends, pushing them further and integrating them more deeply. A major area of anticipated growth is the even deeper integration and enhanced capability of artificial intelligence and machine learning, AI and ML.
AI and ML, we hear those terms everywhere. How might they become even more central to orthopedic practice specifically?
The potential is vast, particularly in diagnostics, surgical planning, and perhaps predicting patient outcomes. AI algorithms are being trained to analyze medical images, X-rays, CTs, MRIs with incredible speed and accuracy,
Better than human eyes?
potentially assisting radiologists and surgeons in identifying subtle pathologies like very early signs of osteoarthritis, tiny microfractures, or complex anatomical variations that might be missed on an initial human review.
Yeah.
This could lead to earlier diagnosis and therefore earlier, perhaps less invasive intervention.
Okay, so better diagnosis. What about planning?
In surgical planning, AI could analyze vast data sets of previous successful procedures and patient outcomes to recommend optimal surgical approaches, implant types, or positioning tailored specifically to an individual patient's profile and goals, essentially providing a sort of AI-driven second opinion or planning assistant.
So AI not just seeing things faster, but actually helping figure out the best way to fix them based on evidence.
Precisely. It's about leveraging big data to enhance clinical decision-making at multiple points. Another crucial future area highlighted is the development of even more advanced biomaterials.
Materials for implants, you mean? What's the goal for these future materials?
The aim is to create implant materials that are not only stronger and more durable than current options, but also better mimic the biological and mechanical properties of natural bone and tissue.
How would that help?
Well, this could involve things like porous structures that allow the patient's own bone to grow into the implant more effectively, achieving better integration, or materials that actively stimulate local healing responses. The goal is implants that integrate seamlessly with the body, last longer, and reduce complications like aseptic listening where the implant becomes loose over time or infection, ultimately reducing the need for revision surgeries.
Making implants that are more compatible and longer lasting within the body sounds ideal. We discussed AI-driven remote monitoring for today. Is that set to become even more sophisticated in the future?
Absolutely. The future really envisions continuous, perhaps almost non-intrusive monitoring via increasingly smart wearable devices or maybe even implantable sensors in some cases. AI would then analyze this constant stream of physiological and biomechanical data in real time.
What could that achieve?
It could enable predictive analytics, identifying subtle shifts in a patient's recovery trajectory before a complication like an infection or an implant issue actually becomes clinically apparent. This allows for even earlier, more targeted intervention, potentially preventing serious problems.
Proactive care powered by continuous data streams.
Very interesting. And regenerative medicine applications, are they also expanding beyond the surgical suite? You mentioned non-surgical uses earlier.
Yes, the potential of regenerative medicine for non-surgical applications is a significant area of ongoing research and development. This includes more advanced forms of therapies like injecting concentrated sources of growth factors such as platelet-rich plasma, PRP, which comes from the patient's own blood, or perhaps stem cells derived from the patient's own body directly into damaged areas,
Like where?
like into arthritic joints or chronically injured tendons. The hope is to stimulate natural healing and reduce pain and inflammation without needing invasive surgery. This could offer alternative treatment pathways for conditions that might otherwise eventually require joint replacement or complex surgical repair, offering less invasive biological options first. And finally, the report mentions bioabsorbable implants as a key future advancement. What exactly are those, and why are they considered beneficial?
Bioabsorbable implants are a very exciting development, I think. These are implants, things like screws, pins, plates, or even sutures made from special materials designed to gradually and safely degrade and be absorbed by the body over a period of time.
How long does that take?
Typically months to perhaps a couple of years, depending on the material and the application. They provide the necessary mechanical support while the body heals its own tissue. And then, once their job is done, they essentially disappear naturally.
So they just dissolve away, no trace left.
Precisely. The major benefit here is the elimination of the need for a second surgery, just to remove the implant once healing is complete.
Avoiding another operation.
Exactly. Which is common practice for certain types of fracture fixation implants, particularly in children, for example. Avoiding a second operation reduces healthcare costs, minimizes patient inconvenience and anxiety, and of course eliminates the inherent risks associated with any surgical procedure, no matter how routine it might seem.
That's a clear and very significant patient benefit. Do their mechanical properties match permanent implants yet, though? Are they strong enough?
That's the area of ongoing research. Matching the required strength and the duration of support needed for all applications is still a challenge, but they are already effective and widely used for certain indications. Material science is rapidly improving their capabilities for wider use in the future.
Okay. Now, while all this innovation sounds incredibly promising, the report is also quite pragmatic, isn't it? It outlines significant challenges that accompany these advancements. What are the critical hurdles highlighted?
Yes, the report rightly highlights two paramount challenges, really, for the widespread adoption and effective implementation of these cutting-edge technologies and treatments. Firstly, cost-effectiveness.
The money side.
The money side, yes. Developing and acquiring these advanced technologies, the robotic systems, the 3D printers, sophisticated navigation equipment, producing cell therapies, it's all very expensive. Training surgeons and staff on these systems adds further cost. This raises serious questions about how to make these innovations financially viable within healthcare systems.
And who gets access?
And, critically, how to ensure equitable access, so that these advanced treatments aren't limited only to those who can afford them privately, or those who happen to live in areas with access to leading, well-funded medical centers. Cost and accessibility are significant practical challenges.
Absolutely. What's the second challenge?
Secondly, the ongoing need for rigorous clinical validation. With any new technique or technology, especially those as complex as robotics or AI-assisted planning or cell therapies, it is absolutely essential to conduct robust, well-designed clinical trials.
To prove they actually work better.
To definitively prove their efficacy, their safety, and their superiority, or at least non-inferiority, compared to existing standard of care treatments. Demonstrating reproducible, clinically meaningful improvements and ensuring patient safety over the long term is absolutely crucial before widespread adoption. The report underscores the necessity for close collaboration between clinicians, researchers, and the medical technology industry to navigate these challenges effectively.
So the future isn't just about building the amazing tech, but also proving it works reliably and figuring out how to make it accessible to everyone who needs it. That balance between pushing boundaries and ensuring responsible, equitable application seems absolutely critical.
It is perhaps the defining challenge for the field moving forward, ensuring that this incredible innovation serves the broadest possible patient population effectively and sustainably.
This deep dive has taken us on a truly incredible journey, hasn't it? From ancient splints right through to AI-guided robots. Let's do a quick lightning round now,
Yeah.
just to solidify some of these key innovations and insights we've discussed. Are you ready?
Ready when you are?
Okay. What ancient practice from thousands of years ago is still considered relevant in its basic principle today?
That would be Hippocrates' fundamental principles for treating dislocated shoulders.
Right. Name one technology invented around the turn of the 20th century that completely changed orthopedic diagnosis forever.
The X-ray.
Yeah.
Unquestionably.
What current technological trend is most focused on improving surgical precision and accuracy?
That's robotics and navigation systems.
What technology allows surgeons to effectively practice a complex operation specific to a patient's anatomy before even going into the operating theater?
That's 3D printing, when used to create those patient-specific anatomical models.
Good. What future technology is designed specifically to avoid the need for some patients to have a second surgery just to remove implants?
Bioabsorbable implants.
And finally, what significant tangible benefit was mentioned regarding personalized telerehabilitation programs?
Patients potentially returning to their daily activities up to 30% faster.
Brilliant. A fantastic summary of some truly transformative points there. So, bringing this back to our audience, perhaps mid-senior professionals listening, maybe navigating innovation, strategy, or challenges in their own industries. What are some crucial, actionable takeaways from this deep dive into the evolution and future of orthopedic surgery? What can they learn from this?
Well, I believe there are several powerful insights that are applicable well beyond medicine. Firstly, the history clearly shows that innovation isn't always a smooth, linear path. It can be profoundly accelerated by external pressures or necessity, sometimes from unexpected sources, like conflicts. Leaders should perhaps be prepared for these discontinuous jumps and look for lessons in seemingly unrelated fields.
Right. Be ready for those disruptive catalysts wherever they come from.
Exactly. Secondly, the current cutting-edge technologies we discussed, robotics, 3D printing, minimally invasive techniques, they aren't just theoretical concepts or hype anymore. They are delivering tangible, measurable benefits right now. Improved outcomes, faster recovery, greater personalization. This highlights the importance, I think, of assessing technology not just for its novelty, but for its proven, real-world impact on efficiency, quality, and the user, or in this case, patient experience.
Focusing on the demonstrable benefits, not just the shiny new tech. Makes sense.
Thirdly, the future trajectory, which looks heavily influenced by AI, advanced materials, and biological approaches, signals a shift towards increasingly data-driven, personalized, and less invasive solutions. That's likely true across many sectors, not just healthcare. So, staying attuned to how AI is moving from analysis to predictive power and how material science is enabling new functionalities is crucial for strategic foresight, I would argue.
A clear directional shift towards data-driven, personalized, potentially less disruptive approaches in many areas.
I think so. Fourthly, whilst the pace of innovation is thrilling, the report rightly highlights that those challenges around cost-effectiveness, validation through evidence like rigorous clinical trials, and ensuring equitable access remain absolutely paramount. The successful integration of groundbreaking advancements into widespread practice requires overcoming these hurdles. And this mirrors the challenges faced in scaling many new technologies or business models, demonstrating ROI, proving effectiveness reliably, and ensuring broad rather than limited benefit.
So innovation must always be balanced with robust proof and accessibility.
Indeed. And finally, I suppose, understanding this dynamic, evolving landscape of musculoskeletal health is essential for anyone working in or alongside the healthcare sector, perhaps in technology, or simply for anyone fascinated by how a field with such ancient roots continues to reinvent itself through scientific discovery and technological integration, all aimed at improving human life and function. It's really a compelling case study in applied innovation over centuries.
Those are incredibly insightful takeaways, thank you. They stretch far beyond the operating theater. It's a field that truly embodies that long arc of human problem-solving and technological ambition. Professor, thank you so much for guiding us through this complex and utterly fascinating landscape today, and for drawing out the key insights from the report so clearly.
It's been my pleasure entirely. It is, as you say, a powerful story of human ingenuity applied to a fundamental aspect of the human condition, our ability to move and function effectively.
And to you, our listener, we sincerely hope this deep dive into the evolution and future of orthopedic surgery has provided you with valuable perspective, and perhaps sparked some new thoughts on how innovation unfolds in any field. If you found this deep dive valuable, please do take just a moment to rate and share the show with a colleague who might also benefit from these insights. As we wrap up, perhaps consider this provocative thought, building on those challenges we discussed towards the end. Given the rapid advancements, particularly in things like AI and regenerative medicine and their associated costs, How might the landscape of access to cutting-edge orthopedic care actually evolve in the coming years? And what practical steps are really needed from the medical community, from industry, from policymakers to ensure these innovations can realistically benefit everyone who needs them and not just remain available to a privileged few? Something to ponder. That's all for this deep dive. You can find out more about the deep dive wherever you get your podcasts. Join us next time for another in-depth exploration.